Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, November 30th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Thank you, Sophie.
In the United States yesterday, we saw 47,000 positive new cases, with our hospitalization rate increasing by 12% and the death rate increasing by 2%. And the overall number of cases is increasing by 7% over the last 7 days. In Illinois, yesterday, we saw 2,528 new cases, but on November 28th, Illinois hit 8,332 new cases. Cases are increasing by 3%, hospitalizations are increasing by 13%. Unfortunately, in Illinois, the death rate is decreasing by 37%. So I just named a lot of increases in numbers. Is this the winter surge starting, Dr. Murphy?
Well, that's a good question, and it may be if this continues. We have to look at the pattern over a period of time, but everybody is expecting this wave to come in December, which starts tomorrow. This is also happening around the world. So there seems to be, in the publicly available data, the numbers are increasing in many places. So this could be the beginning of the winter wave. We'll see. So right now, the viruses are competing with each other. So respiratory syncytial virus, RSV, flu, and COVID, all competing. You can get them together, the infections, but typically one is going to dominate. Right. So this is going to play out very quickly.
Right. Well, and going into our first COVID headline, and the big one that the news is covering all over the place right now, is the China protests break out as COVID cases are surging and lockdowns are persisting. So what can you tell us about what's going on all over the country of China?
Yeah, so China took a very different approach than other places, very strict mitigations with lockdowns, isolation facilities, blocking travel, making people stay home, closing companies, closing schools. It's been incredibly disruptive to their economy and to just their way of life. And the people are really tired of it. Now, the good side of that, if there is a good side, is that they've only had 16,000 reported deaths from COVID. This is a country that's approximately 4 times more populous than the United States. We've had 1.1 million deaths.
Right.
So, I mean, they've had relatively few deaths. Their approach is the strict mitigations. Our approach, and the approach of most of the other countries, has been push the vaccines out there. Some mitigations, some may apply, but it's mostly a vaccine and treatment approach, and just live with it. And that's what's happening now. So the problem with the Chinese is that, in mainland China anyway, they can't even get the mRNA vaccines. That's the Pfizer and Moderna. Really good. And so they have several vaccines available that are okay, but they're not great. And then the people are not taking the boosters. So they've received sort of a suboptimal vaccine, in the past. They're not up to date on the boosters. Now, if you remember what happened in early 2020 in New York, in the northeast part of the United States, I mean, the virus took off, the hospitals were overwhelmed. China doesn't have that capacity. They're already kind of very low capacity for hospitalizations. So if they get a huge surge in hospitalizations, it would be the same situation that we had in New York in spring of 2020. So they're stuck in this place right now. So some of the other areas that are in Macau that are not as heavily controlled by mainland China have imported the Pfizer-BioNTech vaccine and are pushing the vaccines. You may have remembered a couple months ago, there was a lot of deaths in Hong Kong because, again, the people weren't taking the boosters, but they're working through that. So it's going to be a real scene there in China, because I don't know how long the people are going to take this type of approach. It is so disruptive, and they just can't tolerate it.
Right. No, absolutely.
I mean, the government there could fall.
Right. And, going into our second headline, which ties very closely into what we were just discussing, is that China's COVID infections are dropping for the first time in more than, over a week now. But, in general, China's had like a huge spike in cases and now it's finally going down. So what would this mean for the restrictions?
Yeah. Well, I mean, mitigation works. Closing factories, closing schools, stopping people from, getting in, together in groups. That all works. We know that works. And so that's why they're seeing the cases go down. And the original thinking, when this was put into place and done so strictly and was enforced, was that, we're going to wipe out COVID in the world. And as everybody knows, this is not going to happen. It's going to become some type of endemic infection, just like influenza.
Yeah. And now going into our third headline is that new boosters add limited protection against COVID-19 illness. The first world study is now showing. So what can you tell us about the new boosters targeting the variants?
Well, we know that as the virus evolved, that the protection from getting an infection decreased over time. So originally it was 80 to 90% effective from preventing infection, and that's dropped down to about 50%. So kind of like the flu vaccine with influenza. And so this is COVID now is the same with that. What still works though is it prevents the severe disease. So, the hospitalizations are way down. The hospitals have plenty of capacity. The ICUs are not full anymore. Now, the pediatric ICUs are loaded because they're getting RSV, COVID, and influenza in these kids. It's all tied in together too, because when the mitigations were in place in 2020 and 21, we hardly had no flu. It almost like disappeared. And so people didn't get it, so they didn't get any immunity from that. And then, vaccine uptake has fallen off for all the vaccines, which is really going to cause a big problem. And that's why we're going to have it. That's why we will have a winter surge, probably with flu, RSV, and COVID. And the best thing that you can do now to stop that, to deal with it, is update your COVID vaccine, get the new bivalent vaccine, and take a flu shot.
Yeah.
It was here. It's 6 weeks early.
Yeah, no, absolutely. And then going into our viewer submitted question, and an article that came out in the New York Times really touched on this, which are that there are these 5 unusual COVID symptoms, and what should one do about them? So can you tell us about these 5 unusual symptoms and how often they occur, etc.?
Well, they don't occur that often, but I think the one that people remember from the very beginning was the COVID toe. These bluish colored toes, and that was, a lot of pictures of that and everything. We don't see it too often with the Omicron, but it does happen. But other things that have been reported less often are hairy tongue, get kind of a coating on the tongue, tingling in the nerves, rashes, just kind of unexplained, non-specific rashes, and hair loss, a thinning of the hair and hair loss. Besides the COVID toe, which is, I guess it falls into the category of a rash, but the difference in the rash I was talking about before, it's more diffuse and in general and non-specific. COVID toe is very specific, limited to the toes and kind of purplish color. So they're not common. They do go away after the infection has resolved.
Wonderful. Well, thank you so much, Dr. Murphy, and we will see you next Wednesday.
Okay, see you next week.
Thank you.